Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Internuclear ophthalmoplegia. In internuclear ophthalmoplegia, there is a lesion in the medial longitudinal fasciculus. Actually, for the conjugate eye movement, so for example, if this is the ipsilateral eye, this is the contralateral eye. For moving this side, this right eyes, sorry, this is the right eye, this is the right eye, this is the left eye. Okay, right eye's lateral rectus should contract and the left eye's medial rectus should contract. This right eye lateral rectus is controlled by right parapontine reticular formation, whereas the medial rectus is actually controlled by the contralateral medial rectus is controlled by medial longitudinal fasciculus. So if there is any lesion in the medial longitudinal fasciculus, this movement does not occur. So here the ipsilateral eye will abduct, but adduction in this eye is not there. So as a result, here what is happening, there is defective adduction is seen in the ipsilateral eye. Because of this, there is defective adduction in the ipsilateral eye is seen, and there is ataxic nystagmus is seen on the contralateral abducting eye. So if you see the picture, in the picture, right, so in the picture, this is the baseline. On moving this side, both sides is normal. Now once you move to the left side, here the lateral rectus is working. Because of the medial longitudinal fasciculus lesion, this medial rectus is not working, so there is defective adduction in the medial rectus is seen in the internuclear ophthalmoplegia.
thank you and thank you for watching.